And coming up next, we have our popular segment called Health and Nutrition. The hostess of this popular segment, like I said, is Dr. Lalita Kaul. Dr. Kaul is a teaching professor at Howard University College of Medicine. Today, this doctor is caught on Women's Worldview with a discussion on food and medicine. Let's see.
Good morning, Dr. Kaul talking about health and nutrition. Today I want to talk to you about food and medicine, the interaction. There's a lot of information there. I have just summarized for you the information from my book, so I just to keep it to the time, so I'm going to read it. And most of us take medications over the counter or prescribed by the physician. And the latest study showed that more and more medicines have been prescribed. Of course, physician won't prescribe unless they are necessary, but there is more, last week's report said more opiates and painkillers and have been expressed. So, in this brief time, I want to talk to you the interaction of some of the medications and foods to eat. So, you are aware if you are having gastric distress, you cannot sleep, you are having cramps. So, it is important that you are aware of it. And as you know, the food chemistry can change after few hours of digestion. So does when you take the medications. For example, I am going to list few which are common: aspirin, and under this comes anacin, Bayer anacin, and all these are pain relievers. I am listing here is aspirin, ibuprofen, under that comes Advil, Motrin, Nuprin. And how many of us we have in our medicine closet, we have pain. If you take it too frequently, please keep in mind, take these foods to avoid, take it with food to avoid irritating your stomach. So, if in the morning you are having pain, you are taking this medication, maybe take it after breakfast. If you take empty stomach for a day or two, you may not have that much problem, but if you need to take it regularly, and especially Motrin and Advil, so they can some people are allergic to aspirin, so they take Tylenol, and that goes for Tylenol as well. Tylenol is not as irritating to stomach. Then the other is, how many of us have to take antibiotics, whether it is tetracycline, penicillin or other medication. And it is good to know some basic facts when you are taking these antibiotics. Sometimes the physician in his or her busy practice may not remember to tell you, but you should look it up and find out or ask the nurse, are there any dietary restriction. Especially the dairy foods, you should not combine with antibiotics, and which dairy foods contain calcium. And iron supplements as well can block the absorption. So, if you are taking you want to take all the medicines together, you are taking iron supplement, your dairy, it may be cereal or just a glass of milk, and take your antibiotic, absorption will be lower. So, it is better to put hour or 2 hours. Suppose you are taking 3 times medication, so that means about you do not want to get middle of the night, you probably will do 9, 3, 9, and it does not have to be exact 24 hours. So, the 9 o'clock you can take after breakfast. Somebody say, I do not eat breakfast, but that is my another topic. Breakfast is important. So, do not take with, if you are taking iron and at the same time, take a different time. Citrus food like fruits and juices, if you take your antibiotic, especially penicillin, it can destroy the absorption. But some other antibiotics may be okay, like Cipro and all. There are so many out there. Of course, your physician will decide which one you need to take. But B, at least if you know, it's hard to remember so much information, the basic. If you don't remember, you can always go WebMD or some very research this thing they give in very simple language. Now, the other thing is many of you have to take blood thinning medications, anticoagulant. You might be on Coumadin or dicumarol. It usually the physician puts the patient on anticoagulants after heart surgery to prevent a clot or after some other surgery, and so Plavix is another thing. So, you should be aware that because they are anti-thinner, they want to keep the blood thin and prevent the clotting, and which can initiate heart attack. So, and vitamin K, some of you may know it, some of you may not know. Vitamin K is very important in blood clotting. So, if you cut a finger and you see in a minute it starts thickening, because the vitamin K comes and starts coagulating. So, what happens is vitamin K, we have a natural mechanism in our body, and if we bleed, it will stop bleeding. But where you taking medication to keep the blood thin, so the vitamin K in green leafy vegetables will prevent to keep the blood thin, but small amount is okay. And so, if you or your somebody in your family, friends taking vitamin K, I was surprised, some of the patients were not told by the physician. So, when I was taking the history, I said, oh, you are anti. So, what about? He says, I don't know, I love spinach, I love kale, I love greens, I take it. I said, it's okay, it's not this thing, but cut it, or if you can give it up. So, remember, if you are on blood thinners, do not take greens, leafy vegetable, because vitamin K in that will cut down on clotting, and that is what the doctor does not want, a clot. Then the other thing is antacids, and how many of us run to the medicine closet and get any of this liquid? I know some people have severe acidity, they are just drinking, or all these medicines, Prilosec, Zantac, Prevacid, all these. And what can happen is, if you are taking it too much, it can especially all these antacids, liquid ones have aluminum in them, and it can cause your nutrients, prevent them from getting absorbed, or it can absorb them so fast, the effect of the medication will be very severe. It can go either way. So, all these antacids, and some of these antacids will weaken your heart medications. That means, if you are taking digoxin for your heart failure or some other medication, it will weaken the medications, and it will affect also the anti-ulcer medications, Tegament and all that. So, be sure to read all the alerts on the labels. Now, usually when you pick up your medications, they have little thing, most of the drugstores give, pharmacists give you, but I always read, I do not find anything, very little on the food. Before it was many people in the community, physicians, they did not pay much attention to the drug, medicine, food interaction. They oh, just take it. And now when I have the patient come, they take, some of the elderly are taking 6, 7 medication. They say green pill, yellow pill, blue. So, I said, next time you come, can you bring all the containers? So, I will tell them, I will write it to them, take it either before food, after food, do not take two these together. Sometimes physicians do not have time, but I think it is good. I do incorporate this lecture since last 4 years in my lecture to the medical students. So, it is very important, if you have any antibiotics you are taking, whether you are taking antacids, sorry, whether you are taking calcium Tums, you are taking Alka-Seltzer, you are taking Zantac, all these. Make sure all the medications you are taking, whether it is for hypertension, heart failure, do not take them in one lump. Just see, okay, I have having GERD, I got to take this medication, take it, wait 2 hours, then take your other medication, or vice versa. So, please keep this in mind, because these things are available on the market. Then we have antidepressants. Many people take antidepressants, the doctor has prescribed, and these medications sometimes can, you have, the doctor usually in the beginning keeps a check that this medication does not increase your blood pressure. So, you have to be very careful, to make notations. So, call the doctor on the next visit what happened. Now, what happens is some of the message is that some people are allergic to it when they are taking these medications. If they take foods containing lot of tyramine, Tyrmine. Tyramine is a kind of amino acid found in some foods, and some people acts as a stimulant, and the tyramine is very found in, then they should avoid beer, cheese, red wine, cured meats, aged cheese, avocado, sour cream, and yeast product. So, if you are taking more precisely MAO inhibitor, some of you might know it, the pathway it goes through. I do not have time to describe. So, any time you are taking antidepressants, keep a note of what foods make you sick while you are taking that. Is it like you took beer before, you cannot take it, you took red wine. You may be able to tolerate white wine, but red wine has more tyramine. You may not be able to take aged cheese, and the symptoms might come. You might get severe headache, you might get intolerance, you might get flatulence. And so, these are some. Also, the other 1, 2, 3 I want to mention is garlic pills. Garlic in food is okay, but if you are taking massive doses of pills, and it acts as a blood thinner. So, you do not want that unless there is some condition you have to. So, always see what you are taking. Now, the other is steroids. Doctor might put you on steroids for some chronic condition for long term. In steroid, people tend to gain more weight. It is because there is sodium retention, which is salt in the body, and the salt retains water, and you can edema, and this can make you gain weight, and if you are hypertensive. So, if you are taking steroids for a long time, you should take a diet low in salt, very low. It is impossible to eat without salt, but just cut down on these ready-made foods where this is it. Then if you are taking medications for cancer treatment, then also you may require folic acid in your diet extra. Why I am taking you, sometimes physicians themselves are not sure, and they tell me, so they want to be sure before they pass the information, or sometimes they are very busy. So, do not leave everything to the physician. I know he or she making the diagnosis, prescribing medication, give this, but you as a concerned consumer should also look for your health, and any questions go with the physician or other healthcare professionals. So, in finally, what I am saying is take a record of what medications you are taking prescribed, over the counter, supplements, and look it up and see what kind of reactions you may have. You may not have any, so you do not have to worry. So, when the patients come, or your friends, colleagues, they feel you know more, come with symptoms, do not overlook this. You might say, oh, did you eat something? Fine, but what else is going on that is causing gas, headache, These are common everyday problems. We cannot every time run to the doctor and say, I am having gas, I am feeling bloated, but you see what you are eating. So, if you are taking medicines, think of food, what you are eating and how it is interacting. Thank you very much.